Hi, today I'm going to be modeling the cardiac cycle. The cardiac cycle is the beginning of a heartbeat to a second. Some terms that are important to know is systole and diastole. Systole is known as the contraction of the heart and diastole is known as the relaxation of the heart. Blood is going to enter through the superior vena cava into the right atrium. Then in the right atrium, the deoxygenated blood will flow into the tricuspid valve. Once in the tricuspid valve, the blood will flow into the right ventricle, which is this one right here. Then from the right ventricle, the deoxygenated blood will go into the pulmonary artery or semilunar valve. Then it will come out of here and into the lungs. And then oxygenated blood will enter through the pulmonary vein, which are these two right here, then into the left atrium shown here. Then once in the left atrium, the blood will go through the bicuspid valve, which is this right here, into the left ventricle. Then it will go back into the aortic arch up here, and then back into the body. The P wave shown here is the atrial depolarization. The QRS complex is the ventricular depolarization, and the T wave is known as a ventricular repolarization. During atrial contraction on the ECG, the P wave is ending and the Q and the R waves appear. The aortic pressure remains steadily, but then it will slowly decrease. This will allow for some blood to enter, but not all, and accounting for 20 to 30% of the ventricular filling. At the end of this phase, the ventricles have reached their maximum volume, known as the end diastolic volume, EDV. During this phase of atrial contraction, the AV valves are open and the semilunar valves are closed. Something often referred to when modeling the cardiac cycle is a haunted house, and during the atrial contraction, the haunted house would allow for some people to enter but not all, and then the AV valves would remain open for a few more people to enter, but the semilunar valves will remain closed. During the next phase of the cardiac cycle is the isovolumetric contraction, often known as ventricular systole. Ventricular contraction is isometric at this time, so no blood has been moved out of the ventricles. And like in the haunted house, once the people are in, they cannot leave and no more can be added. The AV valves are closed in this phase, and as in the analogy, the door would rapidly shut, causing a sound which is known as the first heartbeat, the first heart sound. The semilunar valves remain closed, and the ventricular pressure has not yet exceeded the arterial pressure to open the valves up. The next phase of the cardiac cycle is ventricular ejection, or often known as ventricular systole. The QRS complex is completed in the ECG, as is the ST segment. The T wave begins in this phase. Ventricles will contract in this phase, and blood is moved because of the contraction.